how quickly can someone's diet or the food they take change the chances of fertility and affect fertility?
The time period that you will hear the most is around about 3 months. And this is because it takes around about 90 to 100 days for eggs to mature and develop before ovulation. Similarly, in terms of sperm health, it takes about 2.5 months for the sperm to develop. People can be a bit worried. They're like, oh God, my diet has not been the greatest for the past 10 years. But it's like, okay, that's in the past. There's nothing that we can do about that. And that's not really what we're focusing on right now. We're focusing on this window of opportunity that we do have. So actually, it can be really quite empowering for patients.
Ro, I think before we dive in, congratulations are in order because you won the Best Dietitian Award at the European Fertility Society. So I saw that and I thought that's pretty impressive because, first of all, not a lot of people would draw a link between fertility and diet and nutrition. And within that world of expertise in academia, you're the best.
I know it's quite a scary but amazing crown to have. And I must say, I was jointly awarded this with my colleague, Stephanie Velakis, who's from Australia. And certainly in terms of dietetics, fertility nutrition wasn't really a thing. It wasn't on university curriculums. We obviously know about, the importance of preconception nutrition, etc. But actually, in recent years, we've really started to get down into the detail as to the role that nutrition can specifically play in fertility. So I've just enjoyed my time in this space so much, and it's incredible to get that acknowledgement. But yeah, hopefully this is just the beginning in terms of where fertility nutrition can go.
When it comes to fertility, and if you think about a typical heterosexual couple, a third of infertility cases are associated with female factors. A third are often unexplained or due to a combination of both want to be parents. And a third of infertility cases are to do with the man. Historically, people have seen infertility as a woman's issue. And if they have associated any infertility issues to a man, it's because of either low sperm count. But actually, there's a lot more than just low sperm count or sperm quality when it comes to male factors being involved with infertility. So how important is it that men also make these changes with nutrition and diet, supplementation if needed, to improve fertility for both?
It's so important. And as you say, we've got those different segments. When you kind of add it up, male factor plays a role in up to 50% of cases of infertility. Wow. So, and we've got, all the different sperm parameters. And we actually, we know that sperm quality has decreased dramatically over the past 5-6 decades. And there's lots actually that nutrition and lifestyle can do to improve the status of this. But I do think it's really, really important that there is a growing acknowledgement now of male infertility, which is a really important thing because, as you say, the woman before did carry this big burden, this big stress on her shoulders. And it is a bit of a team effort. And also people think about, okay, the male plays a role in helping the female to get pregnant. But actually, sperm quality, and in particular DNA fragmentation, plays a role in maintaining pregnancy. So high levels of sperm DNA fragmentation are associated with increased risk of miscarriage. So it really doesn't just stop at the point of conception.
So actually, that traditional trope that people have that, there's this biological clock for women, and men can have kids whenever they want is wildly inaccurate because men also have that biological clock when it comes to DNA fragmentation of the sperm. The sperm will degrade over time. So a man in his 60s or 70s may still have some fertility and technically have a child with a younger woman. The chances are very low, and there's a higher chance of genetic mutations and miscarriage because of the much poorer quality of sperm in a man in his 60s compared to 20s, for example.
You're absolutely right. And I'm just glad that this conversation is becoming more commonplace now, and more men are understanding the role that they're going to play in that couple's fertility journey.
And according to the World Health Organization, 1 in 6 people globally experience some degree of infertility. You mentioned the dropping, sperm count in men over several decades that we've seen. that's one of the reasons. What do you think are other obvious reasons apart from that? I mean, do you think we can attribute some part of this down to changing dietary and nutritional behaviors? Is there other sort of major components that you think contribute to this?
Oh, yeah, absolutely. And to be honest, I really think a big contender is we're having children much later. Society is really different now compared to what it used to be. And, say for women in particular, there's so many more opportunities now in terms of career. There's just so many things to do in terms of having fun, in terms of traveling. And you know what? Women are actually really enjoying this. But, there are other reasons as well in terms of people may not have found their right partner, or they may have been in a relationship and then that kind of broke down. Because we're doing things a little bit later, we do know that age is a big factor when it comes to infertility. So this is certainly part of the equation. But then we also have the fact that we as a population are a higher weight than what we used to be. Our diets and our lifestyles are poorer than what they used to be. And even just the amount of EDCs, so endocrine disrupting chemicals, that are kind of within our environment is higher than what it used to be. And that also plays a role when it comes to infertility. So it's a bundle of reasons really all coming together.
And when it comes to food, it's probably not a specifically, scientifically oriented question, but I guess there is some credence to this. Are there any fertility friendly foods, without sounding very pseudoscientific? Are there foods that you'd commonly associate with, okay, actually that's probably good for fertility?
Definitely. And if we're to give some of the top ones, we might think green leafy veg, high in nutrients, but importantly, they're often high in folate as well, which is very important when it comes to fertility. Antioxidant rich food, so your fruits, your vegetables, your herbs, your spices, oily fish with its omega-3. Even an interesting one is beetroot because of its level of nitrates that convert to nitric oxide in the body. And there is reason to believe that this can enhance the blood flow to the uterus, which can support with implantation. And also just nuts and seeds. I mean, there's even been studies, randomized control trials on and looking at men and consumption of nuts, and consumption of 60 grams of nuts over a 14-week period significantly increased a number of different sperm parameters. Nothing else changed, just the nuts. So those are just some examples of foods that can positively influence fertility. And I think, it's an important point that you made at the beginning. Nutrition isn't a magic wand, but what it can do is it can increase the chance, increase the probability of positive things happening, and it can reduce the risk of more negative things happening. So nutrition is a piece of the puzzle, but it's an important one.
So, given that it's such an easy lever for people to pull when it comes to nutrition without jumping to medications and actual supplements that people may need to take, what are some common dietary reasons that could explain someone's low fertility in both men and women?
So it could be a variety of different factors, but to give you some examples, it could be that somebody is of a higher weight. It could be because somebody is of a lower weight. And at both ends of this kind of like BMI scale, this can have implications on reproductive hormones. So this can influence fertility. Also, just in terms of nutritional status. So if people have low antioxidant status, this means that generally it's associated with having poorer fertility outcomes and higher risk of miscarriage. Also, if people are in a pro-inflammatory, if they're in an inflammatory state. Also, an interesting one is nutrient deficiencies. So there are deficiencies such as vitamin D, vitamin B12, iron, folate. And if people are deficient in these nutrients, it's associated with higher risk of infertility. And then you also get to like dietary management, or dietary changes can support the management of several health conditions that are implicated in fertility. For example, PCOS, endometriosis, celiac disease, diabetes. So really there's all sorts of reasons. And, it's really fascinating, working in a fertility nutrition clinic, and people can come in and, on paper, they may look quite similar, but then you come in and then kind of like the journey to reaching their solution can be quite different.
So, I can't help but think that given some of the foods that you've outlined are fertility friendly, they're also obviously generally nutrient dense foods, good for your diet, good for your gut health. There's clearly some sort of massive overlap between gut health, the gut microbiome, other microbiomes, and fertility as well. We know that there's a subset of the microbiome, the estrobolome, which is involved in estrogen metabolism and recycling, which will obviously have an impact on a lot of estrogen-driven conditions like endometriosis, PCOS, but also fertility as well. So, higher fiber intakes generally associated with better health outcomes and reduced rates of metabolic disease. I suspect it may be associated with better fertility outcomes as well.
I think that fertility in the microbiome is a really, really interesting space. And I think it's quite an exciting time for it. I feel we've still got somewhere to go before we're going to be in a place that we're really happy with. But what we do know from the research that exists at the moment is that there are differences in terms of between the microbiomes of fertile and infertile populations. But I would say, in terms of understanding the application of that and what that treatment should be, I would say that's kind of the missing link. But I think we're on our way to understanding this more. What we also don't know is because we've obviously got the gut microbiome, which is what people are most familiar with, but there are obviously different microbiomes that are associated with fertility. So, for example, the vaginal microbiome, the endometrial microbiome, and we're not sure at the moment whether bacteria from the gut can translocate elsewhere. But we do know in terms of the vaginal microbiome, again, this is a really, really interesting area of research and practice in the dysbiosis, so an imbalance in the microbiome, the vaginal microbiome, it has been associated with a higher risk of recurrent miscarriage and also implantation failure. So it's a potential treatment intervention here of certain probiotics to support this. And then I guess another interesting point to add is that people with PCOS and also with endometriosis have been seen to have lower levels of lactobacillus than in quote unquote healthy populations. And, there have been studies to say that some probiotics have supported the management of certain outcomes of PCOS. So again, a really, really interesting field. And I'm kind of excited to see what comes with it, really.
Yeah, that is really interesting. I think there probably is some degree of bacterial translocation between the gut and vagina. I don't know if there is between the gut and the endometrium, but that is really interesting for probably a lot of people to acknowledge that beyond the gut microbiome, the skin microbiome, there's also the vaginal microbiome, which can obviously be a hostile or friendly environment for sperm, which can obviously dictate conception, but also the endometrium. Can that endometrial microbiome dictate implantation, the health of the embryo, miscarriage rates, all those sort of things? And it is interesting to know that there is research looking at the role of probiotic supplementation potentially in how that could guide personalized treatment for different types of infertility. We know there's so many different types. So, I guess we can't outright say that a specific type of diet can improve infertility in cases where there's tubal blockage, for example. But there may be a role for some sort of probiotics in that sort of case where it could help in some sort of mechanical, anatomical way as well. So how far do you think we are in the science and our evolution of understanding of probiotics and those unique new microbiomes, and then having that sort of practical application where someone can get an over-the-counter probiotic and help with their infertility based on the science?
So I'd say we're in a reasonable place right now, and still even at this point, because the thing is, if somebody has had recurrent miscarriage, they've had, 3-4 miscarriages, and they're like, what can I do? it's a really reasonable point at which to say, do we want to consider this? And there is research on particular strains, and there are probiotics that are designed for female reproductive health. So at this point, we can offer it, but it's really about being transparent and saying, this isn't a magic wand. This isn't guaranteed to solve the problem, but it could potentially be a tool in the toolkit, because in research, it has helped some women. It hasn't helped everybody. It's helped some people. But yeah, I think we've got a little bit further to go, because there may be strains that we haven't yet discovered that could be, that could be even better. So we've got a way to go. I'd really hope that in 5 years' time we'd be in a good place. But I, just as well as I do, these things in medicine all take time.
Yeah, and my concern is also around people using the small kernel of truth to then sell things which maybe don't do anything, to prey on those people who are desperate to, conceive. And then they use that sort of tiny bit of scientific knowledge to then create something which doesn't work and, ruins the hopes of these women. And when you talk about trying probiotics, if you've, had 4 or 5 miscarriages, nothing's working, how do you, improve your fertility? All these things that you mentioned, whether it's drinking beetroot juice, optimizing your diet, trying vaginal probiotics, it's low risk and it's gaining cumulative percentage points to increase your chance, right? And if you can gain an extra 0.5%, that's a number I've picked out of the air, doing each of these things, it just tilts the odds in your favor. And, if you're desperate to conceive, and it's such a huge milestone in so many people's lives, realistically, what is the cost and risk of those things? Pretty much nothing when it comes to, having a baby.
That's what I think as well. And when you think about the cost of fertility treatment, I mean, some people are paying, like £15,000 for one single round of IVF. I mean, some people at some clinics pay more if they're adding on all the add-ons. So it's really expensive. So this is also my position because some consultants may argue the effectiveness of certain supplements. The cost of a supplement that could increase probability of certain important aspects of a fertility treatment journey, it's so low cost, especially when you compare it to, say, this £15,000 that people are spending. But it is about, it's not worth going for these things that, is going to give you maybe, like next to no chance. There needs to be some science behind it. There needs to be reason behind it. And yeah, there's a lot of information online. There's a lot of misinformation online. So I would say, speak to people who've got the credentials, speak to people who are actually like registered health professionals, because they have to go by the book. Like they have to. And then I feel that you'll just probably be in slightly better hands. Or you can go and, you can seek information from somewhere, but then go and fact check it.
Yeah. And on that topic of supplements, actually, what are some, keystone supplements that you say or you suggest that some people, men and women, if we separate them together and have some overlap between what supplements would work for these people, knowing that it takes 3 months to change things around to improve your diet and nutrition and fertility status. In those 3 months, what can people be doing in terms of taking supplements?
Supplements is a really interesting point. And even for me as a clinician, because before I worked in fertility, I used to work in diabetes and weight management. And really there, we used to think about calories and macros. And really, didn't really dive into the micronutrients. Obviously, the public health guidelines around like vitamin D. But in conditions such as that, the micronutrients play like less of an obvious role. When I came into fertility, I was like, whoa, it's a completely different ball game. And looking at and bearing in mind, the people that tend to come to us in our clinic are dealing with infertility. Mm-hmm. So the advice, if somebody is trying to conceive, is to at least take a folic acid supplement ideally in the 3 months leading up to conception and for the first 12 weeks of pregnancy. And the reason for doing so is because it reduces the risk of neural tube defects. And then just following public health guidelines in terms of supplementing vitamin D in winter months. When it comes to people who are facing infertility or want to kind of like, really optimize their chances in terms of fertility, I actually, to all women who come, I do recommend a prenatal supplement to everybody that comes in to see me with infertility, because the research that has been done on multi-nutrient supplements generally increase the probability of pregnancy, reduce the time it takes to get there. A big thing in terms of infertility is oxidative stress. And what you'll find in most good prenatals is that they will have key antioxidants that support fertility. So vitamin C, vitamin E, selenium, and zinc. So it can help to kind of optimize our antioxidant status a little bit. And it can, these supplements can also help to fill nutrient gaps. I'm a dietitian. I've been a dietitian for many years. My diet will not be nutritionally complete every day. Not a chance. And especially for people, because I've been a vegetarian for many years. I actually became pescatarian just a few years ago. Because before I did a test, I used to have low B12 levels. And I was like, oh, no way. Because I thought, because I had dairy and other things like that, I thought I would be fine, but my levels were lower. And that was one of the reasons for including fish. So yeah, it has many purposes. And going back to our point before, it's a low cost, low risk intervention or addition, if you like, to support your chances of fertility. And also it goes beyond fertility in that it's not just optimizing our chances of fertility. These are the nutrients that we are passing on to the baby as well. They need this. So all in all, I do actually feel prenatal supplements in this group are a very positive thing. There are other supplements that can be considered, like common ones include coenzyme Q10. So coenzyme Q10 is an antioxidant, and levels of coenzyme Q10 in the body reduce as we age, and we see this in women. And what's interesting is where we house the eggs as they kind of like they grow and develop and mature is in the follicles, and then the follicular fluid that surrounds the egg. Basically, this can influence the health and the quality of the egg. And what we see as women age is the levels of coenzyme Q10 in this follicular fluid reduces. So theoretically, it kind of makes sense. And then what we do see from data is that coenzyme Q10 can improve quality of eggs, but we also see that it can increase the number of eggs that are retrieved when it comes to egg collection. And that can either be for egg freezing, or it can be as the kind of like the starting point for IVF. And it's been associated with improvements in clinical pregnancy rates. So this is something that we consider, and it's generally more so implicated in women over the age of 35. But it is one to think about. And then another popular one might be inositol, for example. So myo-inositol, but more so in women with PCOS. Because people with PCOS generally tend to have higher levels of insulin resistance. And inositol is like an insulin sensitizer, so it can sometimes help. But the good thing with this is if you haven't seen an improvement in kind of 3 to 4 months, you can just stop it. If you're not actually seeing any kind of like regulation in your cycle, or you're not seeing any of your PCOS symptoms reduce, then it may not be having kind of like a positive implication for you. In terms of men, it tends to be, so again, we still go with the food first approach. Look at the diet. Are there any gaps? And, try to fill them with food first. If not, then we can look at supplements. Again, men can go for a multi-nutrient supplement. But what gets quite interesting when it comes to male fertility is that when we look at sperm quality, because this is one of the key things, or the main thing really that nutrition can influence when it comes to male fertility, is your sperm parameters. So you've got sperm count, concentration, motility, morphology, DNA fragmentation that we mentioned before. And actually, the recommendation for what nutrients that person may take depends upon the sperm parameter that we want to focus on. So it can really get quite targeted.
Okay, so there isn't a blanket sort of statement we could make for men. I think I've commonly, associated zinc with sperm health in general. However, I'm not aware of what the incidence is of zinc deficiency in men. I suspect it's one of those nutrients which is hard to become deficient in if you're focusing on a wide range of foods, including, nuts and seeds and things like that. So maybe it could be a case of, as part of your nutritional workup, if you are experiencing infertility as a couple, you obviously look at a blood panel, and some of those specific nutrients like zinc or other things for women as well, you're actually screening for those. And then seeing what you're deficient in, and is there easy ways in your diet? Can you improve those? If not, is supplementation the route to go?
Yeah. And I think, we've kind of like jumped into the conversation around supplementation, but having a foundation, and generally we tend to advise like a Mediterranean style diet, which has, higher levels of antioxidants. It's kind of an anti-inflammatory dietary approach as well. This is a really, really good, it's a really good foundation for both men and women. But I would say for men, because a key reason as to why these sperm parameters tend to degrade is due to oxidative stress. So by having plenty of antioxidants, this can help to basically counteract the damage that can be done. And the good thing about with sperm quality as well, I mean, with egg quality, we are born with all the eggs that we will ever have. Whereas with sperm, kind of like new sperm are created. So it's like, men have an opportunity within this window to make a real difference. And actually, in some studies, improvements in sperm quality have been observed in as little as 1 to 2 weeks.
Wow. So actually,
Yeah.
you've got multiple chances as a man to improve the quality of your sperm. So I'm sure many men will rise to the challenge of this gamification that you've outlined, where you can eat more antioxidants, so a wide range of different colored or darkly colored fruits and vegetables. And that's again an easy way, an easy lever to pull, just to try to reduce that oxidative damage and improve some quality purely from diet alone.
Yeah, and it kind of like brings us to the point also in terms of like tests and numbers. Because especially like with guys as well, with men, they're like, okay, give me the facts, give me the data. So this is when, a semen analysis that will tell us, the count, the concentration, the motility, the morphology, etc. Okay, where am I now? And then let's go away. Let's work on diet, lifestyle, supplements if we need to as well. And then let's try to get us to where we are. And these tests just sometimes help things to make sense. And if you're on an infertility journey together, and then you go to your GP after the kind of like the period of time that is advised, then you can get these tests done. The test that isn't often done on the NHS is DNA fragmentation, but it's becoming increasingly utilized now, and more so kind of like in private practice. But it can help to give answers. And again, we mentioned its association with miscarriage before, and it's just, it's such a soul destroying thing for people having to go through again and again. And sometimes tests like these can just really give answers. So I would say, see what tests that you can get available on the NHS, but also if you have the means to do so, sometimes it can be worth exploring other tests such as that.
Yeah, and I think the real switch to people may be beyond the dietary changes having an impact on fertility and the chance of conception. It can improve the quality of the egg. It can improve the quality of the sperm, which leads to a better quality embryo. And ultimately, that means you're conferring those dietary changes you're making today to the child down the line. So I think that switch is a huge change to, it's you're paying it forward. You're not making the changes just for yourself, but actually for a future child.
Oh, definitely. And, one of the things that I find, and, I'm not an expert in epigenetics, but what I do find really fascinating is the diet that you have, your preconception diet, can influence the health and even like, characteristics of your future children, because certain like the presence of certain nutrients or the deficiencies of those nutrients can mean that genes are kind of either turned on or off, if you like, which is just absolutely fascinating. So, nutrition, it really plays such a big role beyond more than what most people think.
Yeah, I think, that whole world of delving into epigenetics to see what environmental factors, lifestyle factors can, as you said, turn off or on specific genes, which can then literally dictate the life that your future child will have, is frightening, but also it's quite romantic in a way that you can actually plot out the life of your child in terms of disease risk, allergy risk, cancer risk, and general how they'll be molded based on things that you do. It's quite scary, the power that that we can have on a future generation.
Yeah.
But a lot of the things that you've mentioned there for the average person, if someone is experiencing chronic conditions, like we've spoken a lot on this podcast about PCOS, polycystic ovarian syndrome, endometriosis, they are pro-inflammatory conditions, in some cases like PCOS, insulin resistance driven conditions, and both are linked with lower fertility, infertility in some cases due to hormonal reasons, some cases due to actual mechanical reasons. Like in endometriosis, you can get scar tissue, which can, impede fertility in some cases. I've seen a lot of data suggesting that there are certain supplements, as you mentioned, myo-inositol, which can help with fertility in PCOS. In endometriosis, there was some enhanced data from the US using the kind of US statistics suggesting that higher fiber intake quartiles is associated with reduced symptoms in endometriosis. There's also recent data coming out that's suggesting that in a small proportion of endometriosis sufferers, low FODMAP diets can help reduce symptoms. Are there specific nutritional interventions that you can offer those specific types of people suffering with those chronic conditions that can improve fertility beyond the sort of general recommendations you'd make?
Great question. And when it comes to take PCOS, for example, so the aim, if somebody, comes to us who has PCOS and associated infertility, then our key objective is to help to manage and improve the management of PCOS. So in saying that, what I mean is regulating the hormones, because when we see a hormone regulation, that's when we can see regulation of the cycle and therefore ovulation, and ovulation when you expect it. And then there are certain dietary interventions that we can think about to enable people to get there. Sometimes with a lot of people with PCOS, some of the management can be around weight management. And the thing is, weight management doesn't work the same with PCOS patients as it does in the general population. And a big reason as to why is this insulin resistance. So generally what we tend to find with patients is having a slightly lower carbohydrate diet. So I mean, avoiding a high carbohydrate intake, having a good protein intake, and looking at a lower glycemic load in terms of the foods that are consumed. This can help to regulate blood glucose. It can help to lessen that insulin resistance, and it makes weight loss much easier. And it's also just even thinking about like the activity that the types of activity that seem to be more effective in people with PCOS tends to be more resistance training and high intensity, as opposed to just, cardio. It just doesn't have quite the same effect. So there's just different ways in which to manage it. And we see some great results. And then, as you say, sometimes there's supplements that we may want to add in there as well. With endometriosis, it's a little bit different because a big thing around endometriosis is the pain, is the awful pain that people have to deal with. And there are nutrient or dietary interventions that can support pain or support other symptoms, such as a lot of people with endometriosis may suffer from with bloating. So you mentioned the low FODMAP diet before. So this can work quite effectively in people with PCOS in terms of reducing such gastrointestinal symptoms such as bloating. But interestingly, there was a study looking at gluten-free diets. And in this one particular study, people who followed a gluten-free diet over 12 years saw significantly lower pain scores than those that didn't. And some people report, I mean, there was actually a survey that was published, I think it was last year I think there were researchers from Edinburgh, and patients just actually saying that when they cut out certain things, like gluten being one of them, that their pain significantly reduced. So it is about working with the patient. But basically, when you are able to help them reduce pain and also reduce inflammation, because as you said, it's an inflammatory condition. So even just having kind of like anti-inflammatory foods, that can drastically reduce pain. When pain is reduced, quality of life improves, relationships with partners improve, their probably desire to want to have sexual intercourse with their partner increases, sex becomes less painful. So it really, in terms of the dietary intervention and its implications on fertility for endometriosis patients, it's more indirect.
Yeah.
It's more managing the symptoms that can then potentially increase fertility by that indirect route.
Endometriosis is obviously, a horrible condition, and you've outlined sort of those factors, dietary factors, which can help with that. Conditions like PCOS, but even obesity, someone who's overweight, other conditions linked with insulin resistance. We've seen that itself, independent of weight, insulin resistance can be a trigger for infertility or associated with it. We've heard over the last few years, this phrase, Ozempic babies, Wegovy babies, and reports of increased fertility in women who are taking some of these weight loss injections, these GLP-1 agonists and other analogs as well. Do you think that is a combination, or independently, is it because of reduced absorption of some contraceptive medication that they're taking? Is it a result of weight loss and then that resulting in improved insulin sensitivity and then allowing more fertility? And also some of those indirect factors you mentioned with endometriosis, but again, losing weight, increased confidence, libido, desire to have sex with a partner. Is it a combination of all of those things? Is one of those factors potentially more important than the others? Or what do you think about that? And also, what do you think about the role of weight loss injections in the paradigm of improving fertility, independent of weight loss?
I think you've outlined the reasons that I also agree with in terms of why did the term Ozempic babies come about? I think, another one as well, just in terms of with weight reduction, because when people have higher BMIs, they have higher levels of estrogen, and that can have kind of like negative effects in terms of the regularity of menstrual cycles. So there is that. There is the improvement in insulin sensitivity, so the reduction in insulin resistance. But yeah, the interesting one around the reduced effectiveness of oral contraceptives, because there were people thinking that they were absolutely fine and they were like, oh my God, I am pregnant. Some people were delighted, some people were slightly terrified. But thankfully, awareness of that is a little bit better. And I do think it's a combination of all three. We know in terms of weight management in general, people can be losing weight to gain access to IVF and then they'll conceive naturally. So it really does play a role. In terms of my position on its role in fertility management, I certainly don't feel there should be a stigma for people who want to utilize them. I think it is about supporting, the right patient. So say, for example, take somebody with PCOS. PCOS is really, really difficult. Weight management is so much more difficult for people with PCOS. As I said, there are ways and strategies in which it can work, but some people may feel like they are banging their head against a brick wall and they are just getting nowhere. And, we've got this, okay, my biological clock is ticking. How can I get there? And sometimes it might be that we consider interventions like this. And I just think you really, really need to agree on a patient by patient basis. The recommendations are that, there were some papers that recommended people should stop the weight loss injections a couple of months before fertility treatments. I've heard from patients that actually the clinics are now tending to say a month before, because there's the risk that we do see weight regain. So when people come off the medication and then they go for fertility treatment, what's the risk then of this weight regain as we're going into the fertility treatment? So basically, when people do come off, there are things that you can do to prevent such a significant weight regain, such as, increasing your protein, increasing your fiber, really, really paying attention to diet and lifestyle, because you can minimize it. But there are risks there, and it is a new area. So I think we just need to tread with caution. And I think we're going to learn more as we go. But I do think that they have a place, and I think that they'll probably have certainly a growing place within society.
Yeah, my hot take is that independent of weight loss, we are going to be seeing over the next few years the increasing microdose or low dose use of weight loss injections like GLP-1, GIP, agonists, because in everyday situations, because we have now growing data, again, aside from the weight loss, benefits in fatty liver, insulin sensitivity, cardioprotective effects, cognitive protective effects, some early evidence that it could at least slow down the incoming dementia or cognitive decline. So I think, a lot of these everyday situations, someone with PCOS who doesn't need to lose weight, but who has insulin resistance, could they benefit from something like a GLP-1 agonist? Potentially, with other lifestyle factors. So I think we'll be seeing a lot more treatment guidelines, maybe not in the sort of public health service, but in private clinics, in concierge, personalized nutrition, personalized healthcare treatments. We'll be seeing these included in a lot of these chronic conditions, specifically metabolic conditions, I think. So, and I think there is a growing role for this as per the data.
And I'm really glad to hear your take on that, because that is also my hope too. I do actually think what these medications are bringing, because, bearing in mind, they were here initially to support type 2 diabetes. Then we noticed, they're quite good at helping people to lose weight. Now they're supporting people to lose weight. We're like, oh my God, people's cardiovascular risk is decreasing significantly. Then we're seeing conditions even such as rheumatoid arthritis improvement because of reductions in inflammation. And as you say, it's like, it's not even necessarily people who are living with a higher weight. So I think it's a really, really exciting time. And, there are so many people that live with these conditions that are really, really tricky to manage. And they have, a really negative implication on quality of life. So I actually think it's quite an exciting time for what these drugs could potentially bring.
And, so far we've spoken a lot about changes people can make in terms of adding things in, but also a key part of fertility could be cutting certain things out. Now, this may not be in food specifically, but other lifestyle interventions. I mean, I don't think we need to explain to people why cutting out alcohol and smoking is important. But one thing which a lot of people love is coffee. So their daily hit of caffeine. What are the sort of thresholds for amounts of caffeine that are acceptable in that preconception stage? And what is the risk of going above that threshold?
So in terms of preconception, actually, there isn't that much strong data to suggest that higher caffeine intakes would negatively affect fertility. Where the risk tends to come is when somebody is pregnant, because there is a very strong association between high caffeine intake and miscarriage. So that's really where it's important. However, just to be safe, the recommendations in terms of caffeine for women is 200 milligrams, is below 200 milligrams per day whilst being pregnant. And these recommendations have just kind of been carried over into fertility. And I think, one of the reasons why is we don't know when we're pregnant sometimes, so it's like, it's a good place to be. I mean, generally speaking, ideally people shouldn't be going above 400 milligrams anyway, in terms of, because it's kind of, we kind of see a bit like a J-shaped curve when it comes to the impact of caffeine or these kind of, or like caffeine containing like drinks, for example, on health. So we don't want to be going above that. But yeah, it is mainly kind of like the association with miscarriage. But interestingly, again, coming back to people who come and see us who've experienced miscarriage before, even though that guidance is 200 milligrams, we tend to go a little bit lower, because there was a paper showed, I think it was a systematic review, that showed that there is an increased risk of miscarriage even at levels of 100 milligrams. So, and when people have gone through a miscarriage, they're like, no worries, I'll cut it out. I'll go for the decaf. So I think it's like, it's a small sacrifice to make, a sacrifice that doesn't cost you any money, might actually save you some money. But again, it's all about, as I said before, it's about either increasing probability of or reducing risk of. And in this case, it's reducing risk of.
And one thing I didn't cover previously when we were talking about some of these specific dietary changes, on both sides of the fence, both men and women, that obviously we spoke about the reducing risk of miscarriage and problems, increasing the chance of fertility. Once someone does become pregnant, do these dietary changes do we have evidence to suggest that these dietary changes can reduce the risk of pregnancy-related complications during pregnancy? So something common like hyperemesis gravidarum, morning sickness, and even other later stage pregnancy-related complications, placenta previa, etc. And do we have evidence that the dietary changes both on the male side, which contributes to the embryo, and on the women's side as well, from the egg side, that can alleviate some of these intra-pregnancy and post-pregnancy issues?
As far as I'm aware, I don't think that pre-pregnancy diets would affect hyperemesis. I'm not aware of any data on that. I think sometimes that can just be bad luck, sadly. But in terms of certainly things like preeclampsia, preterm birth, gestational weight, these things can absolutely be influenced by the mother's health and the mother's nutritional status, and then obviously diet and lifestyle influence that. So yeah, we talk about fertility, but actually like the effects are further reaching.
Fertility seems to be one of those areas where it's poorly understood by the layperson, right? And beyond the layperson, who's advising the layperson? The first pit stop for them is going to be the GP. And I wonder how much does the average GP know in depth about fertility, as you've outlined in this conversation? Now, this is throwing no shade at GPs, because I certainly, as a doctor myself, don't know enough about fertility as an expert like yourself would. So it's worrying on one hand that we don't know enough. Some of these things that you've outlined are pretty basic and can be employed by every single person. So I think more public health information on fertility certainly would be beneficial, but also for doctors like myself in medical school, it would be very useful to learn just snippets of things like this, because you'll be inundated with couples who are experiencing pregnancy, and then you'll refer them on to potentially a gynecologist or, a reproductive specialist, and then they might then go to a private clinic, and they may eventually get the help they seek. But, it's reducing that time lag of time it takes to identify what the problems are. And, I suspect, and again, this is just, pure hypothesis, many problems could be reduced by focusing more on lifestyle factors, which you don't need a doctor to tell you, which, you don't need this podcast certainly to tell you, but, there are certain easy levers for movement, food, diet, supplements that someone could do.
I know. And I think that this actually spans much further than fertility, because, even when I used to work in diabetes, as I said, there are some absolutely fantastic doctors who are really clued up actually on the positive influence that diet and lifestyle can have on several areas of health. But then there's others that are quite fast to issue a prescription or, refer elsewhere. And yeah, I feel this is something that we want to ideally change. I mean, I'd be interested to ask you, because I would hope that this is the case. Do you feel that as time is going on, that, doctors that are coming through now, do you feel that they've got a greater understanding of the influence of kind of like lifestyle medicine, if you like?
Yes and no. I think I see a lot more people gravitating towards lifestyle medicine, and you've got societies like the British Society of Lifestyle Medicine, which certainly I wasn't aware of when I was in medical school, almost a decade and a half ago. So I think there's more awareness in doctors in general that we need to start looking at lifestyle first and foremost. Whether people from medical school, medical students are then gravitating towards that career, I don't know. I think a lot of people are just leaving medicine full stop is the thing, and doing their own thing and providing their own information. So a lot of the information I provide online and even in this podcast, it is not stuff that I've learned in medical school. It's some stuff that I've learned on my own throughout my training, my own independent research, speaking with experts like yourself, and then going and doing deep dives, making videos and doing research for those videos where I go and look up studies and the literature. And, again, I think that's the cornerstone of being in healthcare. It's lifelong research, lifelong learning, because things, whatever we speak about right now could theoretically in 5 years be slightly out of date. Some things that we've mentioned on this podcast could be updated. We could have evidence in 10 years' time that actually, hey, probiotics don't work at all. Or yes, they can 100% do work. So, it could go either way based on research. So I think people just need to do some of their own research and more independent study, basically, I think.
Makes sense. And I think to the point about fertility nutrition and the knowledge of it, I think it's not even just within GPs. It's even I've got work to do even within dietetics and within the general population. So this is part of my role is helping patients, but also part of what I feel my role is advocating for this space and increasing awareness so that more and more people are aware that there are several things that you can do to optimize your fertility that can come from actions that you can take, which I think is quite an empowering point.
Huntriss, the newly crowned best fertility dietitian, it's been an absolute pleasure having you on this podcast, and thanks for enlightening people about a topic which I think more people would do well to know about.
Oh, thank you so much for having me. I've really, really enjoyed the conversation.